Today I would like to share my post-stroke client's rehabilitation journey with you all. He had just joined few days before, and this video contains only 2 days progressive video that I have done manual therapy and also physical therapy. So my name is Manju Shrestha. I work in Wellness. I'm a certified NASM certified trainer, rehab trainer, and physical practitioner. So this was the first day when he arrived in our studio, and his postural assessment. Quite a ruined after 5 months of the event of brain stroke. So it's a lot of imbalance in his body, face, upper and lower extremities. So there's a lot of work to do. Right after the analysis done, then I have started rehab manual therapy because first of all, I decided to start with the relaxation and make sure that its adaptation will be increased. There are a lot of weakness because of the paralysis in the right side of his body, problem with imbalance and coordination. He has a pain and numbness in his fingers and hands. Actually, his overall whole right arms. A little bit tingling sensation. You feel very fatigued. This may continue. May have continued after he has returned home from the hospital. So as you mentioned that he was hospitalized for a month, and after that he was given a physiotherapy treatment for a few sessions. When I asked him whether he was given a referral letter to continue with a personal trainer or local rehab trainers, then he said that I feel quite an awkward moment because he said that doctor advised him to watch YouTube video, which is YouTube video, and practice some exercise. I always recommend, all the YouTube videos are, for us trainer, we can adapt quite quickly and we understand the cueing and everything, the posture. When we when we the teeth push-ups, then we understand what muscles to engage or what areas of the muscles we have to contract and etc. During the push-ups, right? But for them, they have a lot of poor coordination. How can they understand what they are teaching, especially physiotherapists and all the doctors are teaching in YouTube about this post-strokes rehabilitation program? So I think that is not so fair, not so right for him to continue. However, he did that for almost 4 months, and then finally he arrived at our studio, which is a good thing for me to start as well. So with the assessment, he has also speech problems. He cannot talk thoroughly. He kind of stops. I rarely can understand, when he talks. So I have to pause when he's I have to ask him to repeat again, or sometimes I just think that repeating is not so not so fair. He doesn't like to talk, I think. So I try to go with my own cueing and go with the flow that how much his body is adapting at the time. So manual therapy is quite helpful for him, and also helpful for me to understand, what part of body is more like, frozen, or they are, completely sleeping for 5 months already. In terms of memory, I didn't ask him too many questions, because only doctors, or I think neurologists, or those things I really didn't want to bother, because I think he have some appointment with the doctors, and it should be doctor's self, not mine. As long as I remember, whenever I asked him about the well-being and everything, and what his diet and what he has been doing for a whole day, so he could tell me everything. So memory wise, I think he's quite good at the moment. Depression, it was amazing, like when I see him first day, his facial expression, that could tell me that he was like quite depressed. His confidence level and everything was like, I can read with his posture that he was like, almost not really a giving up, but it's like, my leg and arm ever gonna be recovered. It's kind of like, this kind of question I could feel in his eyes. So recognizing those limitations, caused by stroke, I was feeling, at the same time, I was feeling quite confident that I could treat him. So everything, like analyzing, like with this tapotman, and this, trying to find his range of motion, everything, when I stretch his leg and his arms and everything, with my all, like, almost 20-year experience, that being a physical therapist, it wasn't so difficult for me to move his body. Like, it's not the way he wants, it's actually the way I want to move. So the more I spend time, I actually gave him only half an hour, but the more I was treating his body, I was trying to find the location to work. I was quite having fun, and I actually wanted to spend like almost 90 minutes just doing him a manual therapy. I could see him quite relaxed. I was asking time to time whether he's comfortable or not, and also I asked him to let me know if he's feeling any pain when I'm doing therapy, that particular areas that he feel discomfort, and also make sure that his caretaker is around us, so that she could watch while I'm doing, and take advantage of some of the movement, like easier movement, that she could do it at home for him. The paralysis thing is quite a evil, that I think he was having a little bit not so satisfied about it, because he's only 45. I think he's 44 or 45. He's too young to be immobilized, or not being used, not capable to use his legs and arms, which is like, for me, I cannot even think about that. I cannot imagine without using my legs or arms, how can it be, how depressive it would be. So I think these are all the reasons that I wanted to help him. I wanted to see the results in every after the treatment. So I decided to separate differently. So when he arrived every session, at the beginning I start some assessment again and again. I ask him to walk first, and then see his range of motion with the arms and upper and lower limbs, how much range of motion he can bring it. I also make sure that he's not contracting his muscle too much while moving. So overall, these functional movements and everything that I want him to control by his mind, and increase his neuromuscular efficiency every time he does and everything. Same time, I was also concerned about his core. By using one side of body for 5 months, it would have been very exhausted for him. So the core muscles probably, when I see his core muscles was not so strong, and I noticed that at the beginning, and I right away I started his core exercise from the day one, so that he could use his core while he's walking or sitting, or even his posture at the back. He was he was sitting in the rounded back, and then he was looking down on his staves while he was walking. So this is all because he was very conscious that he might fall. So I built up his confidence level, that I always I try to try to give him more confidence that you can look down and straight forward, so that you remember that how you used to walk when you were before the stroke. So how confident you were for yourself. So think about those days when you were walking with healthy legs and healthy arms, healthy body and everything. So this is all I could do, and I could improvise everything every day in a daily basis, by giving him good advices. And I'm not a counselor, but I could be his sister, or I could be his trainer at the same time, so that he could listen to me. Because as I heard from his sister when she bring it to the studio, she said that he's quite an aggressive person in real. So he's his anger level is quite high. Sometimes, even though they tell him good things, they advise him good things, but he will turn them off. So something like that. So bringing back all the energy, calming down his anger, the pain level and everything. It's not easy. It might take a long time, with all the life changing and everything, all milestones, all these milestones. Hopefully will be achieving, and I will help him to achieve those by seeing him every day. So at the moment he has decided to come every day to the studio. Here I'm helping my community, so in a very 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 low fees, because it's a good practice for me and good experience for me. And I'm so passionate about what I'm doing and what I have been doing all these years, bringing all my experience into the bed, that I could treat the post-stroke client, which is for me is another milestone, so that I could learn more and then treat these people and make them feel good. And definitely these blessings will be continue to motivate me to go further ahead. This is all I'm gonna say, and I'm gonna keep on posting his progressive video, I have asked him permission. I have asked permission with his family that I could post these videos, because we have also terms and conditions with our members and with our clients that only when they will allow us to post, then we can post in YouTube, or publish their videos. Actually, I encourage him to be a model, a role model, so that I and him and we all together motivate other people not to lose hope, even though no matter what happened in our life, this this terminal disease, nowadays a lot of disease happening, strokes, and people are going into obesity, feeling depressed, anxiety, and all, etc., etc. These things are common at the moment. Like 70% people are in trauma in everyday life, which is not fair. So he can be a role model, and for us, as a professional, we have to show other people that what we can do, what we can do without visiting doctor. Always the precaution is better than the cure. So doctors are busy, physiotherapists are busy. They have no time to eat. They have no time to take care of themselves. It's too busy. It's not about earning. It's about work. They have to treat their patient, and this is why we have got Rehab Trainer, Essential Trainer course from Australian Physiotherapist Association, and we are a certified Rehab Trainer. As long as we are holding our personal training certificate and we are specialized in something, like we are also physical therapists who could remodel these things and educate our clients to be a healthy person, and we could treat them. So this is why we want to give low pressure to those professionals, those doctors and those physiotherapists, by keeping ourselves healthy and treating those clients after they visit the physiotherapy and doctors. We want to help those clients for the recovery process. Thank you so much for watching my video. I hope this video gonna inspire and motivate people, those are suffering from diseases like post strokes and heart problem. Always drink plenty of water. That doesn't mean like a gallons water, because this is where we get oxygen, and this is how we're gonna hydrate internal organs. So I advise every individual to drink at least 2 glasses. You can always start with 1 glass first to 2 glass, or even 750 ml water in your empty stomach before you brush the teeth. And after that, you can have your good breakfast, clean breakfast, not fried, not junk. At least have your good breakfast, and after that you can always start your good day. Consume your meal, as we all have to live. So always look at that limitation, how much food we needed. We can eat more. Our skin can be stretched. Everything can be stretched. But why do we need to stretch those? Our stomach can be stretched. We can refill with 1 kg of rice, right? 2 cups of rice or 3 cups of rice, but half cup of the rice is okay for leaving our guts. Then why do we need to eat more? So try to eat clean food and fulfill your healthy life, and this is how we're going to survive longer, and then we're going to live our healthy life forever.